questions.
Secretary Kennedy, that's Karen Hall with CBS News. Thanks for being with us today. My question is, in speaking of rural Texas, we know places like Uvalde have experienced one of the worst mass shootings in history. The CDC has previously been responsible for studying gun violence. A lot of those programs have been cut now. Would you still consider gun violence a public health crisis? And who's going to be...
I certainly consider mass shootings a health crisis, and we are doing for the first time real studies to find out what the etiology of that is. And we're looking for the first time at psychiatric drugs. You know, these kind of mass shooting, people have had guns in this country forever. When I was a kid, we had shooting clubs at our school. People, kids, my classmates, other people, would bring a .22 rifle with their guns to school and park it in the parking lot. Nobody was shooting. So there's never been a time in America, in the history of humanity, and people walked into a crowd, into a church or a movie theater or a school or a crowd of strangers and just started randomly shooting. It's happening in our country. It's not happening around the world. And there are many other countries that have comparable levels of guns that we have in this country. We had comparable levels in the 40s, 50s, and 60s, and people weren't doing that. Something changed, and it dramatically changed human behavior. And one of the culprits we need to examine is whether the fact that we are the most over-medicated nation in the world, and that a lot of those are psychiatric drugs that have black box warnings on them that warn of suicidal and homicidal ideation. So we are doing those studies right now for the first time, and we will have an answer.
Last question.
Hold a second. He opened with that. He gets to go back to it.
Thank you.